you currently experiencing any anterior knee pain, so pain right in front of your knee right here, while you're running, jumping, walking, or walking up and down the stairs, you might have a condition called runner's knees. In this video, I'll explain to you what it is and how to fix it. Hey guys, my name is Hopkins Slangler and welcome back to another YouTube video. And for today's video, we're going to be discussing runner's knees, or also known as patellofemoral joint pain syndrome. So, what is patellofemoral joint pain syndrome? This is pain at the anterior aspect of your knee. So right here we have the patellofemoral joint. So this is the joint which allows us to flex and extend our knee right here. And when we flex and extend our knee, our patella tracks up and down. So it glides up and down like this. So when we have a muscular imbalance or a biomechanical imbalance, our patella doesn't track correctly. Reason being, it's not in its best shape. So we're gonna further explain why this happens. Who are the type of people that get this condition? Practically anyone can get patellofemoral joint pain. So people who work in 9 to 5, sedentary jobs, who work in an office, delivery drivers, people who play sports at a high level. The reason why we get this condition is not too well known. However, the way to fix it is through fixing the muscular imbalances. What sort of movements might cause pain? Well, any sort of movements which will consist of flexing and extending the knee. So for example, walking. Not everyone will get pain walking, but quite a few people do get pain walking with this condition. Walking up and down the stairs is quite more common with this condition. Jumping. So any of the athletes will experience it quite a lot when they're jumping. And also squatting. So anyone who goes to the gym or even just squatting at home trying to do your laundry, any form of these movements will cause pain. How would I go about diagnosing this injury? Well, one thing I'll do, I'll assess the person's biomechanics. This is very, very important because it helps us understand any discrepancies leading to more force going towards the knees. So I'll look at the person's hips, knees, and foot. So when we're looking at the knees biomechanics, a lot of the time we're also looking in terms of the patella, how the patella is moving. So first we're looking at the position of the patella. Is it moving a bit more medial, a bit more lateral? Is it pushing a bit down or a bit more up? Now this is heavily dictated by the quads. Your quads start from your hips and insert all the way into your tibial tuberosity right here. There's our patella tendon, our quadricep tendon. If we have tight quads, what happens is that our patella is pulled upwards. Therefore, it's not tracking correctly because it's unable to sit in its groove correctly. So that's one of the things I'll be looking at. So I'll be looking at quad tightness. So if the person has tight quads or tight hip flexors, we're gonna want to relieve that. Next, I'm looking at VMO strength. Our VMO is the muscle right here, also known as the teardrop muscle here, because our quads consist of 4 muscles: our rectus femoris, vastus lateralis, vastus medialis oblique, and vastus intermedialis. Our VMO sits on the medial aspects of our knee. So when we contract our quads, as you can see, it sticks out a bit more. And when it sticks out a bit more, that shows us good muscle definition right here. Some people lack that muscle definition. What the VMO does is the last 30 degrees of knee extension. If we're lacking the strength from the VMO, our patella will move a bit more laterally because the vastus lateralis will overpower it and pull it more this side. And when that happens, that means that our knee is unable to track properly when it's just going through flexion and extension. But if we're able to correct this, it's going to get pulled a bit more medially because our vastus medialis is stronger, therefore keep us a bit more biomechanically strong. Foot biomechanics. What am I looking for and how can this affect my knee pain? Well, if you have a fat foot, for example, navicular drop, such as myself, what tends to happen is that there's an increase in force on the valgus aspect of your knee. If you have an arch, however, as you can see, my knee slightly shifts a bit more this way, keeping the force a bit more aligned rather than going inwards. So this could potentially be fixed through either getting an orthotic or strengthening the glutes. And I'll show you this when we are talking about the hip biomechanics. So I had to tuck in my long sleeve into my shorts so I can expose my hips and show you guys what I want to talk about. So I'm looking to see the person's ability to maintain their pelvis to be relatively straight and also prevent their knees from falling inwards. So we're going to do a test right here where we stand on one leg and we bend our knee. And as you can see, my pelvis just dropped. So my glute here is unable to keep me upright. So if this happens, this puts a lot more force at the knee, especially medially, and also my knee just went inwards as well. All of these factors will contribute to the knee pain the person is currently experiencing and also put a lot more force towards the foot as well. Hence why strengthening the glutes will help us to maintain our stability right here, also prevent us from going on knees going inwards, keep it straight, and put less force at the knee and at the foot. So now that we've discussed the biomechanical issues, I will show you guys the exercises we can do to help correct those issues so you're able to move pain-free.
Now we'll be performing a quad stretch. I'm using a rope in this video. If you don't have the rope, then you can simply use a towel, or you can even use your hand and then pull your leg towards you. You'll feel a big stretch in front of your quad, and this is good because it allows your patella to track better and reduce the risk of accumulating knee pain. I I recommend you hold this stretch for 60 seconds.
Hip flexor stretch. With this stretch, you'll need to be on the floor, and you're going to need to raise one of your legs up while the other's laying down, and then push your hips forward. And as you get more confident with the stretch, you can raise your arms up and you'll feel a bigger stretch. I recommend holding the stretch for 30 seconds and repeating it twice. Clamshells. The purpose of this exercise is to work on the external rotators of your hip, so these are the glutes. Lay down on your side, and I want you to roll your hips forwards and start to open your legs like a clam. You start to feel a burning sensation around your glute area, and this shows that the muscle is working. I recommend you do 3 sets and 12 reps of this exercise. As you get used to this exercise, you can start to increase the rep range. So instead of doing 12, you could do 15 or 20. Also, this exercise will help you keep your knees relatively straight. So when you're bending your knees, instead of them caving in, all of that knee valgus force, you're going to be able to keep it relatively straight. Terminal knee extensions. The focus of this exercise is to work on the VMO muscle, which is part of your quadriceps. The VMO does the last 30 degrees of knee extension. What you're going to do is get a resistance band, place it behind your knee, and I want you to start to move back a little bit so you're able to get some tension. And then I want you to extend your knee. You should feel the work being done at your quadriceps. I recommend 3 sets and 12 reps of this exercise. And as it gets easier, you can increase your rep range from 12 to 15. Leg extensions. The purpose of this exercise is to strengthen your quadricep muscles. Now with this exercise, I recommend doing it later on during the rehab, as there's quite a lot of force going at your knee. So it's better to strengthen your muscles up first before doing this exercise. Once double leg gets too easy, then we could progress to single leg exercises. So I recommend we do 3 sets, 12 reps of this exercise. When you transition to single leg, you could do 3 sets and 8 reps and then progress yourself up from there. Hip hikes. You're going to need a Reebok step, or you could do an off a step at home off the staircase. And all you're going to need to do is drop your hip down and then raise it back up. Essentially what we're doing, we're training our glute muscle to help us stabilize our pelvis. Just like earlier when I showed you guys the biomechanical issues, if you have weak hips, it leads to an increase in force going towards your knees. I recommend you do 3 sets and 12 reps of this exercise and progress it as you start to get stronger. So guys, these are the best exercise stretches we can do to help fix your runner's knees or your patellofemoral joint pain syndrome. Keep in mind, it's all about correcting the biomechanical issues. If we're able to do that, you're going to be moving along more efficiently, and it's going to be a lot less pain going towards your knee joint. Thank you very much guys for watching this video. Please make sure to like, subscribe, and also comment down below if you have any questions about this current topic, or if you have any other issues you guys want me to cover. Have a lovely day.